is if a patient is evaluated by me or one of my colleagues on an outpatient basis, we would think about whether the patient is appropriate to undergo a invasive coronary angiogram. That involves bringing the patient to the cardiac catheterization lab on an outpatient basis and inserting a catheter via one of two principal techniques and anatomical locations. The default approach is through the radial artery, which is here, right near the wrist. So a catheter is taken into the heart, and the arteries are found, and they are injected with iodine-based contrast dye, and an X-ray picture is taken like a video clip, and we see the flow of that through opacification of the X-ray iodine-based contrast dye medium that we use. The idea is to create a picture or skeleton of how that artery looks, and we can see through that whether there are narrowings within the heart arteries that may need to be addressed based on the severity that we deem that we're seeing visually. So the blockage is evaluated by whoever's doing the procedure. Sometimes it's very obvious that's a very critical blockage that needs to be addressed by endovascular means, and one means is typically what that means is advancing a different catheter that is capable of doing an intervention, advancing a wire across the lesion to cross that area, then proceeding with a balloon to sort of inflate that area and make some room to do things that we may need there afterwards. One is potentially advancing an ultrasonic camera inside the artery to look at the vessel size as well as the amount of plaque, what the characterization of the plaque is, quantify the amount of calcium, and then decide whether any further interventions need to be done before we put a stent in. Once we deem whatever we need to be done about that particular lesion is complete, then we proceed with putting in a stent to a metal sort of mesh-like device to pop open and keep that area that was blocked open for as long as possible for the patient. So that's if the lesion or blockage is deemed to be critically severe just by picture alone. But if it's not significant based on certain values, we may defer intervention and just continue medical therapy for the patient without needing to proceed with a stent implantation. Usually the whole process pre-op, meaning prior to the procedure, takes about an hour and a half to get everything ready. Then the actual taking of the pictures, depending on how, give or take, the amount of difficulty of the anatomy, is usually 20 to 30 minutes. If an intervention needs to be performed, such as placing a stent or some of the other things that I mentioned, such as interrogating the blockage with pressure wire, etc., that may take an hour more or so, depending upon the level of complexity that the blockage needs. More often than not, I would say about 95% of the time, we send the patients home the same day, meaning they don't need to stay in the hospital. If all goes well during the procedure, they're feeling well post-procedure, there's nothing to monitor the patient for afterwards, and they feel safe, the patient and family member feels safe and comfortable going home.